And welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Tony Gerk. He is a family physician. Today's Kevin MD article is Even Medical Practices Aren't Immune from the High Cost of Employer-Provided Health Insurance. Tony, welcome to the show.
Thanks, Kevin. I'd like to thank you for inviting me on the podcast. Been a long time follower. Your original blog articles were probably some of the first things I read in the medical commentary arena when I was at the University of Colorado in the early 2000s. Great honor to have my article published on Kevin MD, and I'm thrilled to be here.
All right. Well, thank you so much for writing and for joining me today. So, before talking about the article itself, what led you to write it in the first place?
Yeah, so I'm a family physician in rural northeastern Colorado. Primary owner of a 5 provider primary care practice. We're actually the only traditional private practice in the entire northeast corner of this state. And so I bought into the practice that was started by the family physician that delivered me. So feel a great deal of responsibility to carry on the legacy that he left. And full scope practice, we're taking care of everybody. We do obstetrics, C-sections, we work in the hospital and the nursing homes. And so really feel that we have set ourselves as a cornerstone of this community. And so it's been really important for us to make sure that we have a viable business model that's going to keep this practice in place to care for the community. And so that's kind of the background. And then rising costs and a lot of the challenges we've been facing in the medical side of medicine as a whole over the last 4 or 5 years really brought some of the things to the forefront that I talked about in the article.
All right. So, as listeners know, and I'm sure you know, that private practice is really becoming more in a minority. I was talking to someone yesterday on the podcast saying that the numbers of non-private practice physicians are kind of in the low 20%, and that is only going down. And today, I'm sure we're going to talk about some of the challenges of not only practicing medicine as a family physician, but the challenges of running a private practice as well. So, for those who didn't get a chance to read your article, tell us what it's about.
Yeah, so the background is an interesting story as well. This past summer of 2024, we were looking at another round of premium increases for our employer health insurance.
Mhm.
And and it was just shocking. And unfortunately, what we were getting for increasing premiums was a $7,500 individual deductible for our employees and a $15,000 max out of pocket for their families. Just really almost unsustainable numbers for a lot of folks. And so I reached out to our state academy and asked if they had any resources for me, if there were other practices they had heard from. They connected me with the small business majority here in Colorado who said, we really had a story that needed to be told in small primary care practices. And so they said, you should write an op-ed. And so we started working on it and I finished it, and we're lucky enough to have it picked up by Kevin MD. And so that's kind of the background. And in primary care, just like you alluded to, particularly in private primary care, we've got a tough row to hoe.
Yeah.
We don't have all the tricks that are available to large organizations. We don't have access to a lot of the funding streams that they do. But as my mentor always said, the reason we've survived is because we can juke and jive. We can make decisions on the fly. We can transform our entire practice really quickly. Once we have our team members on board and aligned, we're ready to rock. And so we can make these changes quickly, and we can improve care. And we know that small primary care practices provide higher quality care at lower
Mhm.
cost. But unfortunately, that business model and those successes haven't translated to the financial success that we'd hope for.
Yeah, it's almost like the insurance companies are hitting you at both ends because I'm sure you're getting pressure on the reimbursement side, but because you also have to use them for premiums for your employers, the premiums are going up, but the reimbursements are going down. So, as a
Right.
small business primary care practice, you're getting hit on both sides.
Absolutely. Yeah. And we are really try to be as innovative as we can. So we participate in every value-based care contract we can find, really have tried to make ourselves, an innovative practice. But that oftentimes just means parity as far as payment. It doesn't
Mhm.
mean that we're seeing more reimbursement than we had before. And so yeah, it's difficult.
Give us a sense of how many employees you have in your practice.
Yeah, we have 16 employees. We have two part-time employees, and so five MAs and LPNs, four front desk staff. We employ a full-time ultrasonographer, and then we have a couple of nurses that work on the side for us doing chronic care management and that sort of thing.
So the clinicians who own the practice. So tell us about some of the kind of behind the scenes stuff in terms of managing the practice financially. You mentioned earlier about participating in a lot of innovative products, and you talk about how nimble a private practice is. But take us into some of those discussions in terms of managing some of those financial pressures.
Right. So, when we see opportunities for improved reimbursement, we're always going to take those. But ultimately, it comes down to how many patients can we see. And so, we have our foot in both puddles, so to speak. We want to be innovative. We want to drive transformation and do value-based care, which hopefully means chronic care management and not having to see patients as often. But ultimately, it comes down to a fee-for-service model in
Yeah.
so many ways, where if I see 30 patients in a day, I'm probably going to come out ahead compared to seeing 15. And so that's where, we've seen so many improvements in value-based care, some of the metrics and those sort of things, but it hasn't caught up with fee for service in the potential for reimbursement. So those are the things we try to balance. We don't want to sacrifice the care of our patients and the things that we're doing for numbers. And so we're never going to stack our providers' schedules with 30 patients. And so we just have to make a decision about how many patients can we see and take care of well. When do we open our practice to new patients? Which payers do we feel like we need to attract more of? And it changes. We know that we need to have a certain number of Medicaid patients so that we can maximize those value-based care contracts. We need to have a certain amount of Medicare patients so we can maximize those contracts. And so there's a lot of discussions. We meet as an ownership group once a month, and then every 3 months for a big meeting, and then once a year for a big strategy type yearly meeting. And so what we do is have those discussions. Do we take more patients? Do we not? Here's a new program. Is this something we think we can do and participate in? And so it's a lot of on the fly decision making, some modeling financially to make sure that if we're going to add a new service, it's something that we can do and is ultimately going to improve the experience for our patients and help our business. So and lots of, there's three owners. And so that's not those aren't always easy discussions. I love change. I love to try new things but I have to have those folks that sometimes are more realistic and hold me back and say, you know what, maybe now is not the perfect time. So, it's good to have balance as much as sometimes you can struggle with divided decision making. Ultimately, I think we end up in a pretty good spot.
So you mentioned that when you're coming to choosing a health plan for your employees, you mentioned one particular health plan where I think it was like something like $15,000 out of pocket maximum for families. So what kind of choices do you have? Is that like the only choice that you have as you're deciding what kind of health plan best fits your financial model and what's best for your employees? What kind of options are you dealing with?
It's really interesting and unique part of the state that we live in. So we're so isolated from the big cities along the Front Range of Colorado, Fort Collins, Boulder, Denver, Colorado Springs, and it's expensive to get care here because if someone has, for instance, walks into the emergency room across the street having a STEMI, they're going to be on a helicopter in 10 minutes and get to a cath lab. So care is expensive, and because of that, we have one option for private health insurance here. And we've had a few folks, I'm sure those business owners out there have had these folks approach to tell them that they can, take over their benefits and they can offer your employees more choices and decrease costs. And we've met with a few of those folks. And when they get on with us and they actually start running numbers, their jaws just drop and they say, wow, you have one insurance company available out there.
Mm.
And we say, yeah. And that really is the issue. And I don't know the exact answer to that. Obviously, there's a lot that goes into it and state laws and federal laws and why we see so few options here. But that really is the biggest problem that we have. And then we try to pay our employees really well. And so we try to have them offer them jobs that give them security. And so our employees don't qualify for subsidies. So when we've tried to send them to our state and the federal insurance plan, unfortunately, they're not qualifying for subsidies that would bring these rates down in a meaningful way. So that's been the struggle. And to the point that we've discussed, do we even offer health insurance anymore?
Mhm.
Should we just stipend our employees? It just feels wrong to me. We just can't get to that point to say that, we're providing health care to our community, oftentimes through private insurance, and we're not going to offer that to our employees. So it's always been an option. We've discussed it the last few years, but I feel that we'd be leaving our employees in a worse situation than we are now. I wish we could unwind health insurance from employers. What a crazy decision that was so many years ago to somehow tie those two things together, because it's really insulated folks from the true cost of medicine, because they just don't see how much money goes into their health insurance. But that's not going to happen anytime soon. So, my ultimately my goal is to try to talk about, what we're doing in primary care, particularly in private practice. Yes, the struggles that we're having, but also how successful we can be, moving forward.
So practicing primary care in the rural area is hard enough, but it sounds like you also have to manage the financial aspects and keeping this small business afloat, making sure the lights are on, the doors stay open. So, as a busy rural family practice physician, how do you do it? How do you manage and juggle both of those challenges?
Yeah, sometimes it's just the biggest fire gets put out, on some days. But I've tried to adjust my schedule such that I have time dedicated to administrative work, and then time designated to clinical work. It doesn't always work. Medicine is messy. Questions about patients, impede on my administrative time. But I'm lucky to work with a really great team. We hired a physician who also grew up in our community a year and a half ago. She's fantastic. And so that allowed me to pull back just a little bit from the clinical side. So I see patients full time, 3 days a week, expanded my hours on those days to keep seeing the same number of patients, and then luckily have Tuesday and Thursday afternoons to just work on administrative things, and then figure out, when are there decisions that need to be made that I can make, and when do I need to get the bigger group involved.
So, as I mentioned earlier, the number of physicians going to private practice is slowly going down. So, for those doctors who are listening to us on this podcast here, tell us what kind of questions they should ask themselves to see whether a private practice life like yourself is right for them versus going to a more employed model.
Right. I I just value physician autonomy so much. And for me, that's ultimately what I find drives me, my ability to make decisions, not just for myself, but for my patients. And so that's what has kept me away from the temptations of employment, whether we're being bought out or going to work for a large group. And so we have a med student here right now, he's on a longitudinal rotation. He'll be here he came in October, he'll leave in July. So when I'm talking to him about, his practice decision making and the specialties he goes into, the things I really want people to think about are you happy having someone make decisions for you? Or is your personality more that you want to be driving those decisions?
Hmm.
And there's no right answer. Certainly it's personality driven. We had a physician who worked for us for a couple years, a fantastic physician, still one of my great friends. But he didn't like the business side of it. He
Hmm.
didn't like thinking about hiring and firing, making decisions about, how to allocate money and those sort of things. And so ultimately he went back to an employed position, which has been great for him. The hard part is the financial side of things. I am just flabbergasted by the size of loans that physicians have when they
Hmm.
come out of medical school and residency now.
Yeah.
And so that is really difficult. When I had $185,000 worth of loans, in the mid 2000s, I was worried about it. And then now, looking at folks with 2 and 3 times that amount, how do they pay that if they have to take a pay cut to work in a private practice? And so, but you have to find happiness and fulfillment as well. And so when I talked to the physician who joined us a year and a half ago, I was concerned. I knew she had a lot of loans. I knew that that was a concern for her. And so I thought, I don't know if she'll come to work for us. But ultimately, when she saw how we practice, we saw how happy we were. We're not smiling and skipping down the hallway every moment of every day,
Hmm.
but we have a great work environment. We have a fantastic team here. We are hopefully changing things for the better and an example for other practices. And that drove her to come and work for us. And I hope she'll be an owner, part owner here soon. So it really is a matter of, I think, soul searching for medical students and residents about, where do they find fulfillment and happiness, and what drives them. And hopefully that drives more folks into the private practice world.
So, how about medium term or longer term views in terms of viability of a private practice primary care model in rural America? So, how financially viable do you think that this is going forward?
I'm very bullish. We've got our struggles from time to time, month to month, year to year, and I just fall back on the fact that we are taking such good care of our patients.
Mhm.
Our patients love us. They are our greatest advocates. And so often in this new value-based care world, it feels as though primary care has been tasked with bringing down the cost of medicine, which seems unbearable, kind of unfair. But ultimately, we're the ones who can do it because we're good at it. We can take complex problems and solve them, and then figure out when patients need intervention and when they don't. And my hope is that at some point, when we come to a crossroads in medicine where things are worse than they are now, I don't know,
Mhm.
when that is, that we'll recognize that the only true transformation we're going to have is by elevating primary care. But I also recognize that it's difficult because you're almost, when we talk about primary care reimbursement, we're almost dealing with the counterfactual. When I was
Mhm.
talking to you about the stent patient, that's so easy to quantify. That patient came into the ER, they got their trip to the cath lab, they got their stent, they had their overnight stay, and they're into the cardiology world. The quality is really easy to measure all the way down the line. If I had prevented that
Mhm.
stent in the first place through 20 years of lifestyle interventions, blood pressure control, prevention of diabetes, how do you quantify that? And so I think we need to also not just blindly reward all primary care doctors. And I don't say that as something that's bad, but finding these really high performing practices, talking about what are best practices, how do you engage patients, how do you help them make real change. Those are the things that we need to be showing to the payers to hopefully show long-term investment in primary care is ultimately what's going to save us.
We're talking to Tony Gerk. He is a family physician. Today's Kevin MD article is even medical practices aren't immune from the high cost of employer provided health insurance. Tony, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yeah, so I love to learn about other practices. I love to learn what other practices are doing, and I'm just fascinated by how good small private practices are at adapting and changing. And so that's really what drives me day to day. And I hope there's other physicians out there that feel the same. And if they're motivated to contact me, and we can talk about things going forward. And as we said, it often seems impossible to solve the problems in medicine. And we talked about the fact that primary care is struggling in some ways. But ultimately, when that crossroad comes, physicians need to be ready to rise up and to fight for what we know is right and just, because we can drive better and healthier lives, not for ourselves, not just for our employees, but for our communities. And when we elevate communities, we are solving a lot of problems. And so I hope that folks realize that they need to tell their story, and they need to tell it to everyone. They need to not be complainers.
Mhm.
They need to say the truth and talk about how problems can be solved so that people realize the fight that we're in, and hopefully take our side.
Tony, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Appreciate it, Kevin. Thanks so much.